Welcome to the Heart Surgery Caregiver class at Baylor Scott and White the Heart Hospital. We are so glad you're here. Today, we will cover the essential aspects of supporting and caring for a loved one who has undergone heart surgery. This class is designed to help give you the confidence you need during the recovery process. Thank you for taking the time to be here. Caring for someone after heart surgery can feel overwhelming, but this class will help give you knowledge on caring for someone after heart surgery. Each individual's treatment and recovery are unique. Our objectives today are an initial understanding what happens the day of surgery, learning what to expect during the hospital stay, preparing for the transition home and ongoing care. By the end of this session, you'll have learned some ways to support your loved one physically and emotionally, and recognize when to seek help. What does the heart do? The heart pumps blood around your body with each heartbeat. It is the muscle at the center of your circulatory system that sends oxygenated blood to all parts of the body and removes waste from the cells. Over time, your heart can become impaired, related to valves no longer working properly or blockages that develop, reducing good blood flow to the heart. This can result in the need for heart surgery. What are a few common heart surgeries? 1. Coronary artery bypass surgery. During bypass surgery, heart blockages are not removed. Rather, a new pathway is created around the blocked part of a coronary artery. First, a healthy blood vessel is taken from another part of the body. This is the bypass graft. The graft is attached to the coronary artery beyond the blockage. This way, blood flows through the graft and bypasses the blocked part of the artery. 2. Valve surgery. During valve surgery, an incision is made into the heart to expose the poorly functioning valve. The valve is exposed, and depending on the condition of the valve, it will be repaired or replaced. What to expect the day of surgery. Now, let's talk about what happens as your loved one begins their recovery after surgery. This is an important phase, and knowing what to expect will help you feel prepared. After surgery, the patient will be brought back to their hospital room. The care team will be closely monitoring them and working to make them comfortable. One of the first priorities is removing the breathing tube. This is a normal part of recovery. Once the breathing tube is out, the team will encourage movement as soon as possible. The goal is to have the patient sitting on the edge of the bed, standing, or even sitting in a chair within 4 hours after the breathing tube is removed. Early movement helps prevent complications and speeds recovery. After the breathing tube is removed, the patient may start with clear liquids. The care team will gradually advance their diet as they tolerate more food. Pain after surgery is expected, but generally manageable. The care team will provide medication by mouth and check frequently to make sure the patient is comfortable. Breathing exercises are critical after heart surgery. The patient will use an incentive spirometer every hour while awake to help expand the lungs. They'll also need to cough and take deep breaths regularly. These steps reduce the risk of pneumonia and improve lung recovery. As you can see, recovery starts quickly after surgery. Your role is to encourage movement, remind them to use the spirometer, and support them through these first steps. This is a major life event, not just for your loved one, but for your entire family. Heart surgery is not only a physical experience, it's deeply emotional. Let's talk about the feelings you might encounter before, during, and after surgery. Before surgery, it's normal to have big emotions and big questions, worry and fear. You might feel scared and wonder what could go wrong, not knowing what will happen. The future can feel confusing and uncertain. Hope. Many people feel hopeful that the surgery will help their loved one feel better. While the surgery is happening, waiting can be one of the hardest parts. Stress and tension. You may feel nervous or restless. Prayer and quiet time. Some people pray or take time to reflect to feel calm and strong. Once the surgery is over, emotions can shift quickly. Relief and thankfulness. You may feel grateful and happy the surgery went well. Tiredness. All those emotions can leave you feeling exhausted. Looking ahead, now it's time to focus on healing and getting stronger. These feelings are normal. Give yourself permission to feel them, and remember, you're not alone. The care team is here to support both your loved one and you. Seeing your loved one after heart surgery can feel overwhelming. They may look pale or swollen. This is normal and part of the recovery process. Their hands and feet may feel cold. This is expected after surgery. You'll notice several tubes and monitors. These are essential for recovery and monitoring. Breathing tube, endotracheal tube, helps with breathing during and shortly after surgery. It's connected to a ventilator. Chest tubes, drain fluid and air from around the heart to prevent buildup. Urinary catheter, collects urine to measure output accurately. Pulmonary artery catheter, Swan Gans, monitors heart function and pressures. IV in neck, delivers medication directly into the bloodstream. IV lines, administers necessary medications efficiently. All of these devices are part of the normal recovery process to support healing and provide the best possible care. Offering comfort and reassurance is important. A calm presence can help your loved one feel more at ease during this critical time. Now that you know what to expect visually and physically, let's talk about how you can support them emotionally and practically. Two simple tools can make a big difference in recovery after heart surgery: the heart pillow and the incentive spirometer. Let's talk about what they are, why they matter, and how to use them. A heart pillow provides support and comfort after surgery. It helps reduce pain when coughing, sneezing, or moving. Patients hug the pillow against their chest to provide gentle pressure. This stabilizes the chest and reduces discomfort. It's also helpful when getting in and out of bed or during therapy exercises. Incentive spirometer. This device helps patients take deep breaths to expand their lungs and prevent complications like pneumonia. Patients inhale slowly and deeply through the mouthpiece, aiming to raise the indicator to a certain level. This should be done every hour while awake. Regular use improves lung function, promotes better oxygenation, and helps restore lung capacity after surgery. Tips for effective use. Heart pillow. Encourage your loved one to use the heart pillow whenever they need to cough, sneeze, or move. It is a great source of comfort and support. Incentive spirometer. Remind them to use the spirometer regularly, following the care team's instructions. Consistency is key to recovery. These tools are essential for a smooth recovery, both in the hospital and at home. They help manage pain, support healing, and prevent complications. After surgery, your loved one will follow a heart surgery clinical pathway. This is an important tool that helps guide recovery in the hospital. It's a structured plan that outlines daily goals for the patient. These goals are designed to support healing and help the care team, the patient, and the family work together. Each day, the pathway lists specific activities such as walking, using the incentive spirometer, or practicing breathing exercises. Important note: these are daily goals, but progress can vary depending on the individual case and how the patient is doing. Some goals may take longer, and that's okay. The pathway is flexible. The pathway keeps everyone on the same page and helps track progress. As a caregiver, you can encourage your loved one to meet these goals and celebrate progress. This teamwork makes a big difference in recovery. The heart surgery clinical pathway is more than a checklist, it's a roadmap to healing. What to expect during the hospital stay. The road to recovery. What to expect after surgery. Recovery after surgery focuses on movement, breathing, and nutrition. Pain management. The care team will continue oral medications to keep your loved one comfortable. Hydration and nutrition. Drink liquids daily and regular solid meals. Breathing exercises. Use the incentive spirometer 10 times every hour while awake, and continue deep breathing and coughing for 4 weeks to protect lung health. Mobility. Walk the halls at least 4 times a day. Spend most of the day out of bed, and sit up for all meals. These steps are essential for healing and preventing complications. What to expect when going home. On the back of your heart surgery clinical pathway document, you'll find the 4-week home recovery pathway. This slide shows the 4-week home recovery pathway for patients who had an open approach heart surgery. This guide outlines daily recovery tasks for patients who had the open approach to heart surgery. These tasks are designed to support healing and should be completed every day for 4 consecutive weeks. The pathway provides a structured plan to help patients stay on track during recovery at home. This slide shows the 4-week home recovery pathway for patients who had a minimally invasive heart surgery. It outlines daily recovery tasks that should be completed every day for 4 consecutive weeks to support healing at home. Following this pathway helps patients stay on track and promotes a safe, steady recovery. What to expect when your loved one goes home. When your loved one goes home, they should continue the same recovery activities they started in the hospital. Incentive spirometer. Use it for 4 weeks after discharge to help lungs fully expand and prevent pneumonia. Daily activities. Gradually increase activity to return to normal routines. Meals. Sit upright for all meals. Out of bed. Spend 6 to 8 hours out of bed each day. Walking. Walk 15 minutes, 4 to 6 times daily. Rest. Take breaks when tired. Lifting. Avoid lifting more than 10 pounds until cleared by the care team. Cardiac rehabilitation. Participate in rehabilitation, it's key to recovery. Driving. Do not drive until cleared. Ride in the back seat to avoid airbag impact. Pain management. Some pain is normal. Follow medication instructions and use deep breathing, walking, and distractions like music to help manage discomfort. These steps help support a safe and steady recovery at home. Tracking and logging vital signs at home. When your loved one goes home, tracking vital signs is essential for monitoring recovery. Weight. Log daily morning weight. Call the surgeon if there's a 3-pound gain overnight or a 5-pound gain in a week. Blood pressure. Call if readings are below 100/60 or above 140/90 consistently. Heart rate. Call if resting heart rate is below 50 or above 100. Follow-up. Bring the log of weight, blood pressure, and heart rate to the follow-up appointment. Continue recovery tools. Keep using the heart pillow and do breathing exercises daily. Consistent tracking helps catch issues early and supports a safe recovery. Medication management at home. When your loved one goes home, medication management is critical for recovery. Pick up prescriptions. Make sure all home prescriptions are picked up on the day of discharge. Medication adherence. Take medications exactly as prescribed. Keep a list. Maintain an up-to-date list of medications, dosages, and times. Keep it in a wallet or purse for easy access. Avoid unapproved medications. Do not take other medicines, supplements, or herbal products without informing the doctor. Following these steps helps prevent complications and ensures safe recovery. If your loved one goes home on warfarin, Coumadin, monitoring blood levels is critical. Blood work testing. Get blood levels checked within 2 to 3 days after discharge. Frequent monitoring. Blood work will be checked every few days at first to ensure the correct dosage. Long-term monitoring. Once the blood work goal is reached, testing will happen less often. Always follow the care team's instructions for safe medication management. Checking incisions at home. When your loved one is home, checking incisions daily is essential. Daily care. Wash gently with warm, soapy water in the shower and pat dry with a clean towel. Practice good hand hygiene. Encourage your loved one to wash their hands after using the bathroom, before eating, and frequently throughout the day to reduce infection risk. Avoid soaking in baths, hot tubs, or pools. Do not apply ointments, creams, or oils on the incision. Call the surgeon's office if fever is greater than 100.4 degrees Fahrenheit. Signs of infection: pain, tenderness, redness, or swelling. drainage that is green divided by yellow, or has an odor. Daily monitoring and good hand hygiene are key to preventing complications and supporting healing. Common post-surgery experiences. After heart surgery, your loved one may experience several normal changes. Appetite. Taste may be diminished. Appetite usually returns in a few weeks. Swelling. Common in the leg if an incision was made. Elevate legs, do exercises, and wear support hose if prescribed. Sleep difficulties. If pain is the cause, take pain medication about an hour before bed or consult the doctor. Constipation. Use stool softeners, drink water, walk as approved, and eat fiber-rich foods. Mood swings. Feeling sad or irritable is normal and improves as healing progresses. Seek help if anxiety or depression persists. Incision lump. A small, tender lump at the incision is normal. Call the doctor if swelling, redness, or pain increases. Chest clicking. Occasional clicking in the chest is common and should lessen over time. If it worsens, contact the surgeon. Muscle pain. Tightness in the chest, shoulders, or upper back is normal and improves with time. Pain medication can help. These experiences are usually temporary, but always report concerning changes to the care team. Heart surgery is not just physical, it's emotional for patients and families. Feelings the patient may go through. Denial. This can't be happening to me. Anger. Why did this happen? Bargaining. If I do everything right, maybe I'll heal faster. Sadness. Missing how life used to be. Acceptance. Learning to live with the changes and move forward. Family challenges and changes. Talking problems. Misunderstandings can happen. New roles. Family members may take on responsibilities. Big emotions. Stress affects everyone differently and can cause arguments. Money worries. Paying for care can be stressful. Feeling rushed. Recovery may take longer than expected. New normal. Life looks different now. Adjustment takes time. Support matters. Keep talking, listening, and helping each other. What helps most? Talk openly. Share thoughts and feelings. Be kind. Everyone is doing their best. Ask for help. Doctors, nurses, and counselors are here for you. Emotional recovery is just as important as physical healing. Support makes a big difference. Nutrition after heart surgery. A key to recovery. Appetite changes. Nutrition plays a major role in recovery after heart surgery. It's normal for appetite to decrease and taste to feel dulled after surgery. These changes usually improve within a few weeks. Foods to include: fruits and vegetables, aid healing and reduce inflammation. Whole grains, support heart health and manage cholesterol. Lean proteins, help repair muscles. Healthy fats, avocados, nuts, olive oil. Fatty fish, salmon and sardines reduce inflammation. Foods to avoid: processed meats and foods, high in sodium and unhealthy fats. Sugary items can spike blood sugar and increase inflammation. Saturated fats, avoid butter, fatty meats, and full-fat dairy. Additional tips: stay hydrated, eat small, frequent meals, and follow your healthcare provider's advice. Lifestyle considerations: get enough sleep, engage in moderate exercise as advised, avoid smoking, and limit alcohol. In conclusion, balanced nutrition and healthy habits are essential for recovery and long-term heart health. Always consult your healthcare team for personalized guidance. Starting cardiac rehabilitation. Cardiac rehabilitation is a key part of recovery after heart surgery. Patients should begin cardiac rehabilitation between 3 to 6 weeks after returning home. It's important to call the cardiac rehabilitation program as soon as possible to schedule and start the process. Cardiac rehabilitation helps improve strength, heart health, and confidence for long-term recovery. Optional items to have at home. To make recovery more comfortable, here are two optional items you might consider. Shower chair. Provide stability and safety while showering, reducing the risk of falls. Recliner. Many patients find sleeping in an elevated position easier, and a recliner can help with that. These items aren't required, but they can make the recovery process smoother and more comfortable. My BSW Health app features. The My BSW Health app from Baylor Scott and White Health is a great tool for managing healthcare needs. Key features: appointment scheduling. Book in-person visits or virtual care like e-visits and video visits. Messaging. Communicate directly with your healthcare team. Health tracking. Access lab results, prescriptions, and medical records. Family management. Manage health information for multiple family members. Insurance and billing. View balances, pay bills, and update insurance details. You can download the app from your app store or by texting BETTER to 88408. This app helps keep everything in one place for easier care management. Baylor Scott and White Health offers support after discharge to help ensure a successful home recovery. Heart Surgery Care Companion. As a caregiver, you play a key role in helping your loved one recover successfully after heart surgery. Baylor Scott and White offers the Heart Surgery Care Companion, a digital tool designed to support recovery at home. This is a 30-day program that provides pre-surgery preparation, educational videos, care reminders, recovery activities, daily tasks. Your loved one will complete care reminders, track progress, answer a quick daily symptom questionnaire. These responses go directly to the medical record. If anything seems unusual, the care team will be alerted. Why it matters. Monitoring the recovery progress for 30 days after discharge through these daily check-ins helps prevent complications and supports a smooth recovery. How to access. Your loved one is automatically enrolled. You'll find the program under My Programs in the My BSW Health portal. Encourage your loved one to use the Care Companion every day. It's the best way to stay connected with the care team and ensure a successful recovery at home. Patient Advisory Nurse. PAN line. For recovery questions or concerns, call 800-724-7037 to speak with experienced nurses for advice and support. Important: if your loved one is having a complication or problem, call their surgeon as soon as possible. These resources are here to make recovery safer and smoother. Taking care of yourself helps you care for your loved one. Your role as a caregiver is crucial, but it's just as important to take care of yourself. Here are key ways to support both you and your loved one. Self-compassion. Be kind to yourself. Acknowledge your efforts and progress. Caring for yourself helps you care for them. Breath awareness. Take a moment to practice therapeutic breathing for stress reduction using the square breathing technique. 1. Sit comfortably with both feet on the floor and your hands resting in your lap. 2. Close your eyes. 3. Inhale through your nose for a count of 4, filling your lungs with air. 4. Hold your breath for a count of 4. 5. Exhale slowly through your mouth for a count of 4. 6. Pause for a count of 4. 7. Repeat this cycle 3 times. Social connection. Stay connected with family and friends. Emotional support matters for both patient and caregiver. Mind-body practices. Encourage gentle activities like walking, yoga, or meditation to promote balance and relaxation. Nutrition and sleep. Prepare healthy meals and help create a calm environment for restful sleep. Additional tips. Keep hydrated. Suggest small, frequent meals. Follow medical advice. Offer emotional support. Listening makes a big difference. Conclusion. Caring for a heart surgery patient takes patience and compassion. By focusing on self-care and healthy habits, you can enhance recovery and well-being for both of you. Thank you for your supporting your loved one through their heart surgery recovery, and remember to take care of yourself as well.